The 805 Focus is brought to you in part by Nonprofit Connect. Nonprofit Connect provides superior leadership tools and resources so nonprofit leaders and board members can make valuable decisions to move their organization forward to a sustainable and vibrant future. More information on services online at nonprofitconnect.org.
Welcome to 805 Focus. I'm Dr. Cynder Sinclair with Nonprofit Connect, and we will be bringing you the latest on your favorite nonprofits. So get ready to be inspired. Our special guest today is Eryn Shugart, and Eryn is with Savie Health. Welcome, Eryn.
Thank you so much for having me, Cynder. I'm happy to be here.
Oh gosh, you have quite a story to tell.
I
Of a brand new organization doing amazing work in the community.
Yes.
So tell us, please, all about Savie Health. I even want to know how they got their name, Savie
Okay, yes. Well, I will tell you, first of all, that Savie is the nickname for our founder's adorable little 3-year-old daughter.
Gosh.
Isn't that so sweet?
Oh, that is sweet.
So Savie Health was founded by Dr. Ahmad Nooristani. Dr. Nooristani previously founded the Sloan Noor Foundation Free Clinic in San Luis Obispo.
Oh.
So he founded that free clinic back in 2011. Fast forward several years, he went to work for Lompoc Valley Medical Center as a chief hospitalist.
Okay.
And in his role there, he saw a very similar need. He saw patients who were admitted into the hospital for chronic conditions who had no insurance. And those patients told him, many of them had not seen a physician for years. So, folks were suffering from conditions like diabetes, heart attack, stroke, conditions like that. One man actually was only in his 40s with his entire family to support. He's an agriculture worker, and he suffered a debilitating stroke. On account of that, he was in the hospital, and following that, unable to work, unable to support his family, who then were at risk of homelessness.
Gosh.
So Dr. Nooristani wanted to open a clinic just like he did in San Luis Obispo. And that was how Savie Health came to be. We are brand new. We just opened in June of last year, 2022, and we have just been so incredibly busy seeing patients since that time. Things are going very well.
Gosh, what a beautiful, and you're actually located in Lompoc.
We are in Lompoc. We're a quarter mile away from the hospital, Lompoc Valley Medical Center.
Oh, good.
The hospital lets us have our clinic space for no charge.
Oh, man.
Which is so great
yes.
of them. And also, we send our patients just right over to the hospital for labs and for imaging.
That is perfect.
They give us a huge discount. However, we still do pay for those tests. So our patients do not have to pay a penny for those tests. They're able to have tests for diabetes, complete blood count, all sorts of different tests that they might need, as well as ultrasound or x-ray if they need either of those.
So can people come in, for well baby checkups or annual physical, or in other words, before they're sick, can they come in for a visit?
Absolutely, yes. So our criteria, there's one criteria to be seen at our clinic, and that is that the person has no health insurance.
Oh, okay.
So they do not have Medi-Cal, they do not have private health insurance, they do not have Medicare, they have no insurance. Actually, a second part of that criteria is that they're low to moderate income. So we only serve people in those two categories, and there are a lot of people in Santa Barbara County in those categories.
So they come in and you will see them for free.
Absolutely. And we have a lot of services available to offer our patients.
Okay.
We started initially with just primary care, preventive care. We then added urgent care. So if patients have an infection or they're sick and they need to be seen for that, we're able to see them. We do prefer a patient makes an appointment if possible. However, we can take walk-ins usually. So we added urgent care. We have also added behavioral health care.
Wow.
Our behavioral health care program has really been growing. So as more people throughout Santa Barbara County who are eligible for our services learn about it, they are accessing that resource. As you probably know, post-COVID, really the incidence of mental health issues among people in our country has really skyrocketed.
Yeah.
And so we're just really happy that we can address some of those issues for the uninsured population.
Gosh, what a blessing this is for so many people.
We are so happy to be able to provide the services that we're providing, and some other services that we're providing include case management. All of our patients receive case management. So for instance, if we write a prescription and send that patient to the pharmacy, we will find out if that patient has a plan for how they're going to be able to cover the nominal cost. Usually the costs are very low for our patients' prescriptions. Of those medications, we will make sure there's a plan so they can pay for their medications over time. We're also addressing the social determinants of health with all of our patients. And those are social conditions that really are so very much affect a patient's both physical and emotional well-being. And those include, the condition of one's housing, their access to clean water, their ability to provide enough food for their family, and things like that. So our staff do provide case management for every patient. And additionally, a new service that we're offering is that we are able to enroll any of our patients who are eligible now into Medi-Cal.
Oh, that's great.
Yes. Medi-Cal has expanded their eligibility, and because of that, many of the patients that we've been seeing are eligible. So we will be able to get them enrolled into Medi-Cal.
So once they get enrolled in Medi-Cal, then they wouldn't see you guys anymore? They'd go somewhere else?
That is still to be determined.
Okay.
We are in conversations with the local healthcare organization, Cal Health. There's the possibility that we may be able to provide ongoing health navigation services and even potentially healthcare services to those patients after that point in time. It's not yet established. It's to be determined, but we are looking into that.
Well, that's wonderful. So, golly, I've just got all these questions rolling around in my head. Like, how many patients visits do you typically have in a given, week or month, or however you measure that?
Oh gosh, the numbers have been increasing. So I will say that we opened initially only on Fridays and Saturdays.
Oh, okay.
We had worked with the Santa Barbara County promotores to get the word out about our services, because a lot of the people seeking care at our clinic are either bilingual English-Spanish or monolingual in English-Spanish. And the promotores did a survey to find out when people would be available to come to a free clinic. And Saturday was a very popular day, as you could probably imagine.
It's a good way to go at it, to find out when they can come.
Exactly, yes. And the local public health department, they're not open on Saturdays, so this really gives patients a place to go. We do not ask questions about folks' income. We do not ask questions or require documentation other than a self-certification that they're low to moderate income and they have no insurance.
Okay.
But going back to your question about how many people, so we started Fridays and Saturdays, and We added Wednesdays, and now we've added also Thursdays. So we're open a Wednesday through Saturday of each week, and we're seeing anywhere from 8 to 15 patients a day.
Gosh.
So if you do that math, a couple hundred patients a month, I would say.
So how many providers and or staff do you have working there?
So we have quite a few volunteer physicians.
Oh gosh.
So Dr. Noristani, who founded us, he volunteers his time to see patients at the clinic. We also have a volunteer who's an ER doctor, a family practice doctor, 2 other retired family practice doctors, and we have specialists who, they won't see patients at our clinic, but we can send patients to their clinic or their office for conditions like if a patient needs to see a urologist, an ear, nose, and throat specialist, a cardiologist, a gastroenterologist. I'm not sure if I already said urologist.
Yeah.
And also an ophthalmologist. We are planning to add dental to our services very soon. So we are always in need of volunteer physicians, nurse practitioners, physicians assistants, other medical personnel, both to volunteer at our clinic as well as to see our patients for no charge. And I just cannot even tell you how kind and gracious these specialists are, that they will see our patients free of charge.
Oh man, that's just really remarkable.
It's wonderful.
And so volunteers, let's talk about volunteers. You need volunteers?
We absolutely do. We still have some times when physicians are not available to see our patients. Of course, as you know, doctors are very busy people, and so we try to have all of the time that we're open covered, but sometimes, you know, a doctor has another commitment, and so we definitely are in need of some more physicians so that we can fully cover all of the hours that we're open, Wednesday through Saturday from 9 to 4. Also, we are looking for more specialists to be able to treat our patients, as well as dentists to see our patients, and dentists to eventually volunteer at our clinic once we have that established, which we hope will be the case within the next few months.
Oh, what a beautiful thing you've created there.
It's wonderful. I just feel so grateful that I get to be a part of it.
And do you need other kinds of volunteers that are not medical professionals?
Well, we have scribes. So we have, and these tend to be people who are interested in pursuing a career in the medical field, but they may or may not have experience. And that actually doesn't really matter that much because we can train them. So it's a really good opportunity for someone to obtain some experience, and in a free clinic where we're very busy. So we are looking for scribes. We're looking for bilingual English-Spanish people to be able to help interpret with our patients. Something else we're in the process of establishing is telehealth.
Oh, that's good.
Which is really wonderful. So, you know, bilingual people who can volunteer in our office and explain telehealth to our patients, you know, will be so helpful to have.
Now, when you say scribe, do you mean someone who's going to type on the computer?
They type into the electronic health record as the physician will dictate.
Okay.
Yes.
Great. And so I would imagine a person could go on your website.
Absolutely.
Which I know is at the bottom of the screen, and find out more about how to be a volunteer, what kind of volunteers you need.
Yes. Absolutely. There's actually applications for both clinical and non-clinical volunteers. And I will say that, you know, we are located in Lompoc. However, we also have volunteer opportunities that are remote.
Oh.
I have a couple of amazing young women, both of whom are interested in pursuing a career in medicine, and they're helping me with a variety of projects remotely, which has been very helpful for me.
Oh, gosh. That is great. All right, so now, while they're on the website, you're a 501c3.
We sure are.
So
yes.
they could also
donate.
make a donation, a financial donation.
Yes, and we rely on donations. We need to have donations because we do not bill insurance.
Okay.
So at this point in time, we don't think for this foreseeable future that we will. And so we're very much in need of donations.
Gosh. This is just so wonderful. All right, so I'll bet you have a story or two you could share with us.
Yes, I do. So one of our patients who came into the clinic, I would say last month, I was really sort of sad to hear that this patient had been dealing with a nasal polyp, a growth in her nose, for 2 years.
Oh, gosh.
The growth got bigger and bigger and bigger to where it was blocking her entire nostril, and it was causing her nose to become deformed.
Oh, man.
She literally could not breathe out of her nose. She was trying to sleep every night without being able to breathe out of her nose. She had a deformed nose, and she had nowhere to turn and no options for medical care.
Because she had no money.
Yes, and she was uninsured, and she was not eligible for insurance. And so we saw her, and we got her connected with our ear, nose, and throat specialist, who in the very near future, in the coming weeks, is going to be doing a surgery for free to remove that polyp.
Wow.
This is just going to change this woman's life, and we are just so happy that we can be a part of that.
Gosh, I love that story.
I can tell you another one,
Okay,
too.
I love it.
This is really sweet, too, because this patient came in yesterday. This patient has been coming in since shortly after we opened. We've been open for 8 months now. And she initially came in. She's not a very old person. She's only 63. However, she looks like she's a lot older. And a lot of that is because she just was not eligible for medical insurance, and she had had no medical care. She came in to see us, and she had a lot of health problems. She's suffering from a lot of very painful arthritis in her hands. She had a lot of edema or swelling around her ankles and in other parts of her body. And she just was really not feeling well at all. Our physicians were able to diagnose conditions that she didn't even know that she had, including diabetes.
Oh, man.
She had hypertension. In the past 7 months or so that she's been under our care, her diabetes is controlled now by medication. She does not have high blood pressure. She's taking medication, but her high blood pressure is under control. Her other health problems are controlled, but it was so wonderful. She came in yesterday, and she was just saying happy, happy, happy in Spanish to us. She was just so happy and just thrilled that we could do that for her.
Oh, so she's feeling so much better now.
Yes, she is. Yes, so that really felt good to all of us at the clinic to see that.
That is great. Wow. Such a wonderful thing you're doing for families in that area. And really, you say that people could come from other areas as well.
Absolutely. While our physical office is located, our clinic is located in Lompoc, we're seeing patients from throughout Santa Barbara County.
Oh.
We've seen some patients, some people who are homeless, have come from other areas. We had a man who was schizophrenic, and he came to our clinic. He was homeless, and he said that for his medication to control his schizophrenia, the pharmacy said it would be $1,000.
Oh, gosh.
We were able to get him his medication for schizophrenia at no charge to him at all.
Wow.
Yes. So we felt really good about that, and I know the patient was really happy. He wanted to be compliant and take his medication.
Yeah, sure.
So, but people homeless or, people who have a home can come from throughout Santa Barbara County. We definitely have people who've come from Santa Barbara, lots from the Santa Ynez Valley, Los Alamos, Guadalupe, Santa Maria, Orcutt, all of those areas. And we are available to provide services for the low to moderate population of people who have no health insurance.
And so somebody can just call your number, make an appointment.
Yep.
I mean, somebody, I would imagine, could drive the patient to your place.
Yes. Usually patients do have someone to be able to drive them. Although once we have our telehealth established, we're really happy because some of our patients who have come from a long distance, like the people coming from Santa Barbara, Santa Maria, Solvang, we'll be able to see them for follow-up as well as for behavioral health via telehealth. So
wow. That is just, I'm just blown away. This is just such a great service that you folks have put together there, and it's growing and growing and growing.
It sure is, yes. And again, we're just all feel very happy and grateful to be a part of it.
Yeah, well, thank you for sharing that great story with us.
Of course.
And also for all the good work that you're doing that touches so many lives.
You're welcome. We're happy to do it.
And thank you for joining us on 805 Focus, and we'll see you next time.